Hi everyone, this is Tisha or Dr. Ro here for our RODocs Telemedicine Tuesday, and today we are talking to medical students and residents for our Telemedicine Training Day as a part of National Physicians Week. So to all of the doctors tuning in, happy National Physicians Week. We hope you are having an amazing week and someone has shown you love and appreciation. So for the students, the goal of tonight's session is really to help you learn different ways that you can get experience in the area of telemedicine or digital health, even if it's not being offered through your medical school or residency program. So the three things we're going to talk about today is how to get experience, how to find other people in the telemedicine space, and other things that you can do as a student to be involved in digital health. If you are watching this live or if you're watching the replay, please be sure to share so that other students can benefit from this information as well. And so thanks for tuning in. I see there's somebody that just joined. We're going to get started for our Telemedicine Training Day. So the first thing I would say is to try to get some experience in the telemedicine arena. And specifically, as a medical student, you won't be able to work and do telemedicine, but there are opportunities to learn and see how telemedicine works by inviting a telemedicine doctor to speak at your pre-medical organizations. RODocs, we have a network of doctors all over the United States who would love to come to your college or university and speak to you. So feel free to reach out to us for that opportunity. Second, if you haven't tried a telemedicine visit, I would definitely encourage every student to do so that you understand exactly what it's all about. You don't have to be sick to do a demo of a telemedicine visit. RODocs actually offers free demos for students, and we offer free depression screening for students as well, because we know how strenuous your programs can be. And last but not least, you can apply for a telemedicine internship with RODocs, which would allow you to have a mentor within the RODocs network, someone who's actively doing telemedicine, and to work alongside them. Hi Sharon, hi Karen, thanks for tuning in, and please share so that any medical students on your timeline might benefit. So what is the RODocs Telemedicine Internship? You get a telemedicine mentor, you get to work with them, you can see what their day-to-day in the telemedicine space is like, you get to be a part of our telemedicine group, you get to learn about social media and the business of medicine. As a resident, in order to get telemedicine experience, you can also do the same internship and have a mentor, or you can moonlight with RODocs as well. That opportunity is available for upper level residents and fellows. And we even have some students now putting in a elective or applying for a telemedicine elective. So if that's something you're interested in, we would absolutely love to support you and endorse you as the program for your telemedicine elective. So those are the ways to get experience in the telemedicine space as a medical school student or resident. Second way you can get exposure to the telemedicine space is to go to telemedicine events. A great example would be the American Telemedicine Association conference, which is coming up in Chicago in April. Hi Lisa, hi Tiffany. You should absolutely try to attend the conference. Most conferences will have discounted registrations. And also look for local events. And this may not be your traditional CME through medical organizations, but you can look for events through digital health accelerators or business startup organizations. Johnson & Johnson has labs all around the country, and there are different ones even here in Houston. The Texas Medical Center has an innovation institute. So those are places that you can learn about the different things happening in the med tech space. So if you're on social media, hashtag medtech, hashtag telemedicine, pay attention to the conversations that are happening. Set up Google alerts for telemedicine so that you can know the latest news happening in telemedicine. Also, I would even invite you not only to attend events, but to host an event. Earlier, I mentioned medical students. You could bring a telemedicine speaker to your college or university to speak at your pre-medical organization, or if you're in residency, to speak at grand rounds. But you don't have to have a formal event. You could also host a mixer. Go on meetup.com, put it out there, interested in meeting other people that are interested in digital health, and you may find there are other students, residents, or people just in healthcare that are just like you that are really interested in digital health, and you may find ways to collaborate. Another thing that you can do is look into opportunities for research. There are lots of grants out there that are available. Recently, there's one that just closed for the Robert Woods Johnson Foundation. I know that there are grants that are given through the government as well. So look out for research opportunities. And if you don't see any opportunities, you may even approach your school or program about doing a telemedicine research project. And it doesn't have to be big. It can be something really small, like comparing diabetes outcomes between patients who use telemedicine and patients who don't. And that may be your first opportunity to be published. There is definitely a lack of research in the telemedicine space across the board, and you all are in the perfect position to be the leaders in healthcare by doing that research or initiating that research that unfortunately we physicians that are in practice are often way too busy to do. Hi, Adia, thanks for joining in. Last but not least, I'm going to keep this short and sweet, is community service. There are a lot of places that could benefit from telemedicine and it's not happening. That could be implementing a community service program in your church where you offer health screenings through telemedicine. RODocs would be happy to partner with you on that. You could also offer it through your community barbershop, through your community beauty salon, through your library. So if there's somewhere that you see that there is a health deficit or health disparities, and you're thinking about how do I improve access to care, not only here in the United States, but think global. If you've attended a medical mission and you want to keep in contact with that community and continue to serve that country, telemedicine is a way that you can do that and really broaden your horizons. So in summary, recapping what we've talked about, if you're a student or resident that you're interested in digital health, you're excited about digital health, but you're not getting that experience and you're not getting that content that you need in your medical training, get experience by doing an internship or an elective, moonlight, or find a mentor. Those are many ways to get experience. Attend events in digital health, attend the ATA conference, attend local conferences, and if you can't find events, host an event. Consider looking for research opportunities or coming up with creative research opportunities of your own. And last but not least, give back by trying to implement telemedicine in the communities you see that there is a healthcare shortage, whether here in the United States or globally. I know there's still a lot of distress in Puerto Rico, and there's so many other areas that could use our help, and you as a medical student or resident could create those opportunities. So again, happy National Physicians Week. Today was the first telemedicine training day hosted by RODocs. If you find this information helpful and you would like to invite a doctor from RODocs, a member of the RO network, to your college or university to speak on your behalf to your university, please feel free to reach out to us at info@RODocs or follow us on Facebook, Instagram, Twitter, or LinkedIn @RODocs. I hope you enjoyed tonight's talk and have a great evening.